Well, good morning, everybody. Welcome to the South Tyneside CCG governing body meeting. Once again, being held virtually over the internet as we try and keep ourselves and our communities COVID secure and do our bit about not travelling around and meeting and mixing unnecessarily. We are still, as has become our habit over the last year, streaming this meeting live on YouTube. So that the public can watch if they wish, and we retain our accountability and transparency. So if I can just quickly go around the screen rather than around the table, ask those present to introduce themselves for any members of the public watching. So I'll move to Neil O'Brien first.
Hi, I'm Neil O'Brien. I'm the Chief Clinical Officer for South Tyneside CCG.
Kate.
Hi, I'm Kate Hudson. I'm the Chief Finance Officer and Chief Officer for the CCG.
Matt.
Hi, Matt Brown, Director of Operations at the CCG.
Jeanette.
Hi, I'm Jeanette Scott and I'm the Director of Nursing Quality and Safety at the CCG. Good morning.
Paul.
Hello, I'm Paul Cuskin, layperson for South Tyneside CCG.
Pat.
Good morning, Pat Hall, lay member.
Tarquin.
Hello, I'm Dr. Tarquin Cross. I'm a consultant geriatrician at Northumbria Healthcare and I'm the secondary care clinician on the governing body.
Louise.
Good morning, I'm Louise Leighton, the primary care health professional on the CCG and a community pharmacist in Jarrow.
Vicky.
Good morning, Vicky Pattinson, Director of Adults for South Tyneside Council.
Deb Cornell.
Good morning, so I'm Deb Cornell, Head of Corporate Affairs for the CCG.
Also on the line, I think we have Jane.
Yes, Corporate Governance Manager for the CCG.
And Lee Hogan, who is managing the YouTube streaming for us and will probably want to keep his camera off. I'm aware that I didn't introduce myself when I started talking. For everybody watching, I'm Matthew Walmsley, GP in South Tyneside and Chair of the CCG here in South Tyneside as well. We have apologies from John Whitehouse, who's a lay member who won't be joining us, unfortunately, and Tom Hall, who's the Director of Public Health at the South Tyneside Council, will be along but will be a little late today. Because of Tom only able to join us later on, I'm going to take Chair's prerogative and switch about the agenda a little bit. We'll consider the item on COVID-19 pandemic update when Tom joins us, hopefully at around about 10:30 or a little after that. We have usual standing declarations of interest from a number of different people around this table who also work in other organisations within healthcare that we won't re-declare every single meeting, but they all need to be noted. Does anybody have anything additional that needs to be declared other than the usual standing declarations? No. Okay. In that case, can we first of all take the draft minutes of our last meeting, take them through for accuracy and for matters arising at the same time if we can, page by page. So page 1, page 2, page 3, page 4, page 5, page 6, page 7, page 8, page 9, page 10, page 11. And page 12. No, must have done remarkably well in getting those minutes absolutely spot on. Well done, Jane, for that. I will note before we move on that this meeting is a lot shorter than normal. Items that would normally have been on the cycle of business have deliberately been taken off. Not only those around the table are working very hard on the COVID response, but the teams who support these meetings and provide a lot of the papers and the work between the meetings are also working very hard operationally on COVID and vaccination. So we did take the decision, given where we are, to limit the meeting and shorten the meeting with some of the business that could be moved to other meetings, having done that. So that's the reason for this meeting being quite a bit shorter than normal. Okay, having said that, I'll move on to enclosure 2, Neil O'Brien, Accountable Officer's information.
Yes, thank you, Matthew. It's intentionally a briefer report this time because things are moving so fast in the NHS at the moment. By the time you write it, it's out of date. So there's just really some of the broad headings that I'm happy to take questions on from governing body. But the vaccination, obviously, the information in here is now been superseded. We've obviously now got, well, there's been 3 vaccines approved now in the UK, but mainly we are dealing with the AstraZeneca virus and the Pfizer virus for vaccination, and the region is doing exceptionally well in northeastern Yorkshire in delivering the vaccination. In fact, we are leading the way in England. The South Tyneside in particular has got a fantastically successful program, which is drawing in on the expertise from community pharmacy, hospital services, volunteers, general practice, all pulling together to roll out a very successful program, which I think we can all be very proud of. The vaccine supply has been in the media, and that is the main issue that's holding us back at the moment. But we're working very hard with the NHS just to make sure that we do get adequate vaccine into South Tyneside in order to hit the target of vaccinating cohorts 1 to 4 by mid-February, and we are on track for that. The report also mentions a little bit about the paper on the future of the integrated care service systems. That we have provided our official feedback on the engagement exercise, as have many others, and that's been collated. I believe further direction will come in early February about the next steps on developing the ICS. The chair has been appointed, Sir Liam Donaldson, which is a great appointment. So we need to, in this, in the coming months, start to work together to understand how we really do put place at the centre of the new ICS. And how we just sort out the transition from CCGs into the new ICS, if indeed option 1, which was the ICS becoming the statutory organisation, is the preferred option after the engagement exercise. More locally, there's an update there about the leader review that we did meet the national deadlines, and we have recruited additional staff to infection prevention control, which are doing a fantastic job, and I think we'll all agree that it is vital work at this time. Just to draw governing body's attention, if you haven't already seen it, to the Ockenden report on maternity services. There was a whole load of recommendations in there that providers need to follow and incorporate around better, safer maternity care, and our Director of Nursing is working with the FT to ensure that they are put in place. there's other bits of information in the report, but frailty, our kind of normal bread and butter work, if you like, is still continuing in the background, although all effort is being directed towards COVID vaccination and managing the COVID pandemic. But we are working collaboratively with other CCGs and the hospital system and other partners, local authority and voluntary sector, to try and see how we can manage frailty in a different way. So there's a bit of funding which has come from the NHS, and we're working as an ICP just to look at different ways in which we can both identify and manage frailty in a more joined up way. And I've mentioned the COVID vaccinations. So yeah, that's all I probably had to say, but happy to take any questions.
Thank you, Neil. Colleagues, any comments or questions for Neil on that report? Oh, you muted myself. Thanks very much, Neil. And we'll move on then to the next one item on the agenda, which is Jeanette and the Assurance and Risk Report from the Quality Committee and the Safeguarding Update. Jeanette. You may still be on mute, Jeanette.
Get it right one of these days, coordinating, getting the paper. I'm just wondering if you would like me to share my screen just so you can see the slide. It will be very brief because some of the information that is covered in this was also in Neil's update, but I'll give it a try, and if not, I'll just give you the very high level update around that. I don't think, is it going to work? Could Matthew, could you tell me if you can see that, because you're, yeah, okay. So just in terms of a very brief update, this is a regular report that I give to the governing body, and it just really is an assurance report in terms of the key risks and mitigating actions that have been taken. I won't go over any of the items that we regularly cover, unless there's something new to report. One of the things that I will mention is around Cumbria, Northumberland, Tyne and Wear Foundation Trust, which is the mental health trust that provides services in our patch, is working with Oxford University around a narrative-based risk assessment tool to replace the current, there's two tools currently in place, one in Cumbria and one over the rest of the patch. Because of the issues that have been raised in serious incidents previously, this is an action that the Trust have taken, and we commend them for taking that action. We look forward to seeing the outcome of that piece of work. In terms of infection prevention and control, there's been no change in terms of the ambulance trust and the 2-metre requirement for transportation. That stayed the same. We have good news in terms of the recruitment of the infection prevention control staff, in that the trust have very kindly agreed to release one of the members of staff that they're both currently employed by the trust in early February. So we're going to have one of those members of staff in post very soon, next week. In terms of we monitoring outbreaks and providing advice, and obviously NHS England is also involved in that. The Trust has had a number of outbreaks but have an action plan. That there's significant improvement in the numbers of outbreaks that the Trust have experienced in South Tyneside, and we continue to work closely with the Trust around that. A quick update around the Patient Safety Committee. In January, we received a report in care homes, the current COVID position, and also domiciliary care. We had gone through a period where there was very little in terms of outbreaks of COVID-19 in care homes. We have unfortunately had several outbreaks which now seem to be again under control with the support that's been available. In terms of the learning disability mortality reviews, there's a published report, a review of 206 deaths from the start of the COVID-19 outbreak, and some learning from that has been highlighted. And in terms of the enhanced health in care homes, the rollout of virtual wards is something that's been reviewed and looked at. We already have some very good processes in place in terms of the pulse oximetry monitoring, and that's been very successful to date. And in terms of the Ockenden report was mentioned, that's a maternity report. I won't go over that, but there was some very, very serious findings in that report, and the Trust have provided assurance that they are compliant with the 12 urgent clinical priority actions, so that assurance has been provided. In terms of safeguarding, there's an update there. We have our staff in place. We continue to work as we have. We work virtually. There's been no gap in the partnership meetings, but we do have a new initiative about to roll out in South Tyneside, which is ICON, Babies Cry, You Can Cope, and that's an initiative to support parents, particularly new parents, in those early months of life, with especially where there might be a baby who cries quite a lot. The intention is that they're starting with health staff, but there's opportunities to roll that out with social care partners in the future as well. The rest of it's just brief updates, so I won't go into that in any detail, but I am very happy to take any questions.
Thank you, Jeanette. I assume you can stop sharing your screen while Paul asks a question. Thank you. Perfect.
Paul. Hi, thanks, Jeanette. That was really good. Good layout as well of a report. I just wanted to ask something about the Quality Patient Safety Committee. You talked about care homes. Where are we with the care home COVID vaccines for care home residents in South Tyneside?
We are actually very, very well advanced with that. We're almost complete. It's virtually just mop-up sessions now, where there was a number of people who weren't able to be vaccinated when the programme was undertaken within the home. But there's been a phenomenal effort. It's been fantastic, and we've been really far ahead of the game. So the last I heard, there was about 90% of residents that were vaccinated, and a high percentage, it's not as high of staff, but a high percentage of staff have also been vaccinated, mainly with the Oxford vaccine. Some of the early homes that they did use the Pfizer vaccine, because the large homes, they were able to use the large batches, but in the smaller homes, when the Oxford vaccine came online, they've been out with those vaccines. And obviously as well, we're away, and Louise is here. There's been a fantastic effort last weekend working with our partners in community pharmacy, who have been out vaccinating housebound and housebound carers as well, to address any potential gaps there. So there's already been a significant number of people vaccinated last weekend, and I believe there's another programme being undertaken this weekend.
That's excellent. That's a terrific effort as well.
Good indeed, and we may hear more of that when in Matt and Tom's presentation a little later on, I'm sure. Anything else for Jeanette specifically around the presentation there? No, in that case the committee will note the assurance provided through the presentation, through Jeanette, and through the ongoing work of the Quality and Safety Committee. Can I move us next to the performance report? Matt, a truncated report this session, I think, but some verbal commentary, I'm sure.
Yeah, I'm going to try and share the screen. I'm having a few technical difficulties this morning, so you'll have to let me know if you can see that. So, Matthew, is that on the screen? Yeah, okay. So I'm going to run through fairly briefly. As you say, it's a truncated report on the basis that actually our efforts are focused on the COVID vaccine programme and response. So firstly, I'm going to take you through A&E performance. Now, I guess under normal circumstances, we'd say this is quite a good barometer of pressure in the system. So A&E performance tells us actually how much pressure is in social care, in the community, in hospitals, around general practice. But I think probably at the minute it's not a very good marker of pressure in the system. And actually, therefore, we're looking more internally at the COVID inpatient numbers of patients who are ready for discharge, the intensive care unit capacity pressures. Having said that, you can see that A&E performance has actually been very good for South Tyneside and Sunderland over the last 6 months or so, and really performing amongst the highest in the region and the country. A&E attendances are lower than normal, which is helpful, but actually it's a good marker of the flow through the system that we've had, despite having a large number of COVID inpatients for at least the last 6 weeks or so. I'll just move on quickly to elective treatment performance. So this is the proportion of patients who are seen within 18 weeks, and clearly the target for that is 92%. You can see that big drop, which I've talked about before, in the summer when most NHS services were paused, and as they've come back online, we started to recover that performance back somewhere towards where we would expect it to be under normal circumstances. However, clearly with the impact of the new variant of COVID and the issues we've seen throughout December and January, it's unlikely we'll consider the same pace of recovery on that trajectory. Diagnostics is a similar issue, so we're looking for 1% of people, no more than 1% of patients to be waiting more than 6 weeks for a diagnostic test, so an ultrasound scan, an MRI or so on, but unfortunately we are about 30% at the minute, and that's reflective of the position the rest of the country finds itself in. You're talking about a very high volume of patients having diagnostic tests, many thousands each month, and therefore it is very difficult to recover, and gradually we're looking to do that over time. I touched on this last week, so this is the big drop that we've seen in patients being seen within 2 weeks of urgent GP referrals, and that particularly relates to some breast services, which we touched upon last month, and skin services in Newcastle. There are some mitigating measures in place around teledermatology, which will start to see some impact as we get more recent figures, but that has been a real challenge for us. But even despite that, we've actually seen that the proportion of patients treated within 62 days of that first referral is still actually really pretty good. So really still maintaining our performance about the 85% level, which is the standard we'd expect, with some dips in the summer. So even though there are some patients who are not quite getting the first appointment as quickly as we'd like, the treatment is actually following pretty rapidly thereafter, which is positive. So I've just finished there, Matthew, if that's all right.
So any questions or comments for Matt? No. Okay, we'll note the graphs, the commentary, and the assurance thus provided. Move us on to the financial monitoring report. To Kate.
Thanks, Matthew. I'm not going to share my screen. I'm going to assume you've seen the report. It's the usual format, and I'm not very good at sharing my screen, so I'm not going to even attempt it. So this is the report up to month 9, which is December last year. I won't touch on the revised financial framework I've had previously. The section here, section 3, just alerts us to the COVID vaccination programme and the retrospective claims that can be made via primary care networks for costs incurred. Just was going to flag there that we have to sign those off for the PCNs, and then they are submitted to NHS for payment. There are some exclusions to what can be claimed for. So we're just keeping an eye on that to see whether there's something that the CCG might want to cover that NHS won't cover, if you see what I mean, if that's feasible and appropriate to do so. Other than that, we remain on track to deliver our £2 million surplus that I had flagged earlier in the year. The numbers look a little bit odd in the report because we're waiting for a retrospective claim on hospital discharge programme, etc. But we are still on track to deliver £2 million surplus. We are now able to make amendments and flex block contracts with providers if we want to, which is helpful if we need any flexibility there. Note as well that CHC assessments were restarted in September. There is a query whether or not they will be paused again, given the current rise in COVID activity. We're waiting to hear about that, but that would have an impact on our numbers. The only thing I would say as well, prescribing, so this is all the detail on page 3. In terms of prescribing, the numbers are still moving around a little bit, but what we are starting to see is an increased cost on oxygen. and I suspect that's linked to after effects from COVID potentially. So again, we're just keeping an eye on that because that might see that forecast increase a little bit, but we can cover it if it does. And that was really everything that I wanted to talk about. The risks are flagged in there as well at the bottom of page 4. Otherwise, just open for questions.
Thanks very much, Kate. Any questions for Kate or comments on the report? Pat?
Thank you, Chair. Thanks, Kate. Very concise report, thank you. 2 questions. One is there any risk at all linked to the receipt of the hospital discharge scheme monies? Especially getting it and in time. And the second was the reduction of spend with regard to prescriptions, and do we know what that is, what's causing that?
Thanks, Pat. So in terms of the hospital discharge scheme, I'm not too concerned that all the other retrospective claims that have been put through for the year have been honoured. So there will be some questions asked, I'm sure, about some of the detail, but I don't have a particular concern about that risk of it not being funded. With regard to the prescribing, it's just the usual volatility around prescribing. We're not seeing anything other than the oxygen that are flagged. We're not seeing anything particularly unusual. It's just the ebbs and flows of prescribing forecasts.
Thanks very much. Any other questions for Kate? In that case, we'll note the report, the forecasts within and the assurance provided, and move us on. Welcome, Tom Hall, to the meeting. I noticed you joined us during Kate's presentation there. Do you want to briefly introduce yourself, and then we'll move on? We changed the agenda around so that you can do the COVID update with Matt. We've waited for you, Tom, on that.
Thanks, Matthew. I always make sure I never miss Kate's report. So, thank you. Morning, everyone. I'm Tom Hall. I'm the Director of Public Health for South Tyneside. Apologies for being late.
So really to you, Matt, and Tom, then for the COVID pandemic and vaccine management update.
Okay, thanks, Matthew. I think we're going to do a little bit of a double act. I'll start, if that's okay. Just talking about some of the recent epidemiology. I'm going to keep it fairly brief because I guess people tend to have more questions, and we can always take those, and then Matt will pick up a bit on the vaccination programme, if that's okay. So hopefully I should be able to share my screen, which is at the moment. Matthew, give me a nod. Yeah, brilliant. Okay, so thanks everybody. I just wanted to give you some of the usual figures that we've shared at the governing body, just so you can see what the latest epidemiology has been like. It has been quite a challenging winter so far, as you'll probably all recognise. I think the Christmas period brought with it some significant pressures as a result of that Christmas period, but we're now thankfully on a downward trajectory in terms of the case rates in South Tyneside. It's quite a complicated graph, so I'll just point out the kind of key line I'm going to keep taking you back to, which is this blue line here. That's South Tyneside, and you can see kind of rising and falling throughout December and into January. Like I say, we're thankfully on a downward trajectory at the moment, albeit over the last few days we've seen that downward trajectory starting to slow a little bit. Our case rate has now dropped down to 281 cases per 100,000, so we've gone below the 300 cases per 100,000 mark. But as you can see on this chart here, even going down to that level, which is quite a significant fall since the beginning of January, we're still relatively high to where we were at compared to the other peaks and troughs we've seen during the pandemic. Obviously, we saw national lockdown brought in at the beginning of January. I think that has kind of partly explained some of the fall now. We're starting to see some of the data coming through as a result of the national lockdown. But I think one of the other things is we saw this quite artificial spike, I guess, in the beginning of January, as we saw people prior to Christmas not getting tested necessarily. We saw our testing rates drop prior to the Christmas period, which explains this dip here. And then we saw really quite a large spike in cases just after the Christmas period and at the turn of the new year. So thankfully, it started to come down. In real numbers, that looks about 379 cases in the last 7 days, what we've had. And that compares to 448 in the 7 days prior to that. That's still a lot of community transmission. You know, there is a lot of cases out there. I think lockdown 3.0 is very different to where we were in March last year, in that businesses are in the main continuing to operate when people can't work from home. So we still do have a lot of services that are functioning where people have to be working in warehouses. They might be driving taxis. There are a lot of businesses where people are back at work and perhaps they weren't necessarily doing that during lockdown phase 1. Having said that, we're not necessarily seeing particular institutional based outbreaks. We're just seeing a lot of transmission across the borough. We have, thankfully, of late started to see quite a reduction in the number of outbreaks in care homes, and Vicky might want to say a little bit more on that in a minute. So our care home outbreaks have started to diminish, which is good to see, because prior to the Christmas period, this blip that we had in South Tyneside, which is different to the rest of the northeast there, we had a number of quite large care home outbreaks, but also the trust was dealing with a lot of cases on the hospital site, and they were dealing with a number of ward outbreaks, and I have spoken about that previously. I think at its peak, the trust was seeing some 120 COVID positive patients in the hospital. Thankfully, now that's dropped to being between 60 and 70 COVID positive individuals in the I should specifically say the South Tyneside District Hospital site. So between 60 and 70 COVID positive individuals at the South Tyneside District Hospital site. So we are in a different place to where we were prior to Christmas with the hospital setting and care homes, thankfully. But it still is a challenging position. We must continue to do all the things we've trailed so far in terms of the basic messaging around hand washing, social distancing, mask wearing. But also we need to start thinking about how we look ahead to the potential easing of lockdown if we start to see the case rates come down even further, and what that might mean to getting certain businesses back up and running, and obviously reopening the schools. I'm just going to pause there on the case rate to see if there's any questions from anyone just before I talk you through a little bit more detail on that. No, that's fine. I think one of the things I would.
Sorry, Tom. Sorry.
Yeah,
I think Jeanette wanted to come in, Tom.
Okay.
Yeah, thanks, Tom. I just wondered if it was worth mentioning the prevalence of the new variant in our region and also locally, because I think people might be interested to know that.
You took the words right out of my mouth, Jeanette. So that was one of the next things I was going to say, is that obviously one of the things that drove the national spike in cases prior to Christmas was the new variant that had been seen in London and Kent. It very quickly became the dominant strain in London and the southeast. In South Tyneside, the proportion of our cases up to the end, up to the 25th of January, I think it is, the proportion of our cases that are down to the new variant was actually 62.5% of the cases. So it has become the most dominant strain in South Tyneside and indeed the rest of the northeast. But we are a bit behind. We're certainly behind where London and the southeast were prior to the Christmas break. So that may partially explain the fact that although the case rates have dropped off, they are starting to plateau somewhat as well, because we are still dealing with a much more transmissible variant of the COVID virus. So that is one of the theories behind why those transmission rates have not dropped away.
Tom, I think Vicky's tried to come in as well.
Yes, thank you, Matthew. I was just going to pick up on Tom's point about the care homes. We did have some significant outbreaks before the Christmas period, but I am pleased to say that the care homes are in a much better position, and we are working with them collectively with our partners to provide them with support. And as we touched on before, there's been a fantastic effort in terms of the vaccination programme for our care homes. So we do know now that all of our care homes have been vaccinated, apart from a couple, you know, the ones that we haven't been able to do because of the outbreaks, but over 90% of the homes have been vaccinated. So we're in a really good position in terms of vaccinations and outbreaks at this moment in time.
Thank you. And Patty, you wanted to come in as well, quick before Tom carries on?
Thank you. I think it would be useful to get a bit of feedback from the care homes themselves in terms of the level of support that they're receiving, please.
And Vicky, do you want to come back on that?
Yes.
One?
Yeah, just so we can do that.
Okay, and then Tom, do you want to carry on with your presentation?
Yeah, just on that point, Pat, I think it's worth saying that Vicky and the team and others have regular catch-up meetings with the managers and then regional managers as well, so that we're working very much hand in glove with them. Those meetings are on at least a weekly basis. And we also have a care home support team, a core team, which consists of clinical, commissioning, public health, communication staff, and they're the wraparound team that work with care homes. So we do have quite a comprehensive package in place, and we do have that regular dialogue with them. But yeah, we could get some more formal feedback if you think that would be helpful to do.
Pat?
Thanks for that, Tom. We are just some assurance to the board that we at the Quality Patient Safety Committee do receive a report and an update. I just wondered if there was some current update from the care homes themselves, so it'd be useful to get that in our usual report. Thank you.
Thanks very much. I'm sure we can do that. And Tom, over to you to move on.
Bring the slides back up again. Yeah, just before I hand over to Matt, I just thought governing body members might be interested to look at some of the age profile data. So this is a breakdown of that epidemiological curve I showed you just before, but by age category. So you can see that the rates in different age groups here. So we've got the 0 to 14 age category has remained the lowest rate of COVID in our age groups. It's been fairly consistently the lowest. We saw a little bit of a kind of surge post kind of like school opening and during the half-term period in November, but is remained pretty much the lowest category throughout the pandemic. Our other focus obviously is on those who are perhaps more susceptible to adverse outcomes of COVID, and particularly the over 65s. And you can see the green line here. It's currently the second lowest rate, thankfully, but it has fluctuated during the pandemic, but has often remained the kind of second lowest category. So I think that goes back to the approach that we tried to take to protect the most vulnerable, particularly with a focus on care homes and our domiciliary care providers, and obviously the work that all the GP and wider primary care professionals have been doing throughout the pandemic to try and protect those who are the most vulnerable. And obviously we've had the shielding arrangements. You can actually see the difficulty we faced in December with that surge in over 65 populations. When I mentioned before, related to several care home outbreaks and obviously the outbreaks we had on the wards at South Tyneside District Hospital. So you can actually see that quite clearly in the data. But thankfully they remain one of our lower rates of COVID, and indeed on that declining picture as well that I described before. So I was just going to stop there on some of the epidemiology. I don't know whether, Matt, you want to pick it up now and then we can take further questions at the end?
Yeah, thanks, Tom. I'll do that. So Neil and Jeanette have both touched on some of this already, and I'll ask you, Tom, just march through the slides when we get to the right point. So just briefly, there's three main channels by which we're delivering the COVID vaccine programme. So we've got local vaccination sites, hospital hubs and mass vaccination centres. It's perhaps worth me taking us back a little bit, because the last time we met as a governing body was at the end of November, and the world has moved on quite some way since then. So we have had 3 vaccines licensed to Pfizer-BioNTech, which was in mid-December, the Oxford AstraZeneca, which was just before New Year, and the Moderna, which is very recent. As soon as we got news that the Pfizer-BioNTech had been licensed, the country has mobilised the vaccination programme, particularly starting with local vaccination sites and some hospital hubs. So for us, we've got Flag Court, which was established and started vaccinating patients on around the 18th of December. The Glen, which was a few days later on about the 21st of December in Hebburn, and Cleveland Park was on about 18th of January, and just a little bit later because of vaccine supply availability. And we've also got an outreach programme that's working from those PCN sites, from those teams. So you'll have seen, and we touched already, that Louise Leiden and the community pharmacists are doing a fantastic job getting out into our housebound communities. And we were also able to start working with some of our care homes before Christmas because of the level of organisation that the teams have got in place. And I probably need to stress at this point that there's a huge amount of energy and effort and work that's gone into establishing those. And fantastic effort, as Neil mentioned earlier. And we just need to make sure we can maintain that into the future. The hospital hubs are particularly vaccinating their own staff. So South Tyneside and Sunderland NHS FT are a long way through their staff now, I think about 2/3 of the way through their programme. And there are other sites such as at the CATW, NIAS, all the other providers that are vaccinating their teams. We've also got mass vaccination centres. So on the 4th of January, the Centre for Life opened vaccinating patients. The Nightingale Hospital started vaccinating patients and staff on Monday this week. That's a really helpful part of the puzzle. I'll talk about that in a second. And as I mentioned, all the vaccines. There are many other vaccines that are in development and presumably will start to be released at some point this year, but obviously those are national considerations. Just move me on there, please, Tom. Okay, so just to talk roughly through where we are with the JCVI cohorts. So the prioritisation order for the order in which we vaccinate people has been very firmly set by the Joint Committee for Vaccination and Immunisation. And the basis of that cohort prioritisation is those people who are most susceptible to death or very serious illness from COVID. So I think that's a really important point to remember, that the reason we're vaccinating in this order is these are the people who are most susceptible themselves. And the national standard that's been set is that we try to vaccinate groups 1 to 4 by the 15th of February, which we're well on course to do. So in terms of care homes, we've talked about those residents. We're actually well above 95–97% for care home residents. And there's a bit of a mop-up programme that's in place, as Jeanette and others have mentioned, as we need to come back to some patients who weren't available to have their vaccine at the time. In terms of those aged 80 and over, we are essentially through that group now. So there are a number of people who are housebound, which Louise Leiden, our community pharmacy teams are working around. But other than that, we're essentially through the 80-year-old age group for South Tyneside. Frontline health and social care workers, we will set the standard of vaccinating that group by the end of this week. It's quite a challenging group to determine exactly who sits within it. The guidance you may or may not have seen is slightly grey on that, but actually we've made enormous strides, and we're really confident that we've got all of those people for South Tyneside and Sunderland vaccinated or booked in for appointments this week, either through our local vaccination service sites or actually particularly this week through the Nightingale site. So we work very closely with the teams of the local authorities, both at South Tyneside and Sunderland, but also all of the other NHS providers across the patch. In terms of those aged over 75 and over, we're through a large majority of those patients. There are still some to get through, but we're confident that we'll be able to get through those this week and into the weekend. And then that leaves us then moving through groups 4A and 4B. So those aged 70 to 74, and what we're calling clinically extremely vulnerable individuals. So this is not those people who have long-term conditions, so perhaps diabetes. This is those people who've got very serious immunosuppression. So they might have had organ transplants, or they might be very, very susceptible to cystic fibrosis. So predominantly the shielding population, although it's not an exact match, I have to say. And in terms of the vaccine supply we are confident that we're going to be able to work through all those groups, particularly into next week. So we're confident of getting through that by the 15th of February. Once we do that, vaccine supply allowing, we'll then start to work through the rest of the population. And it's perhaps worth noting, of course, as you get down the age groups, the size of those groups get bigger and bigger. So there are more and more people to vaccinate. But as they're more mobile, it allows us to vaccinate a little bit quicker with each group. And the little asterisk at the bottom there, I think it's really important to note that we've taken a very proactive approach to some of those groups who would traditionally perhaps not quite come forward for vaccination programmes. So that might be travelling communities, that might be homeless communities, that might be BAME colleagues. There was some news on, there was an article on the BBC News site this morning about the different vaccine uptake rates in different parts of society. But I think we're really confident that with the work that's been led by Dave Julian, by Tom and his team, that actually we're going to be able to make sure we get a long way into those groups. And there's a specific programme looking at that. So I think I'll just move on to the last slide. I just wanted, if you just humour me, Matthew, I just wanted to express some thanks. I know we wouldn't normally do this quite in this way, but it's hard to overstate how hard people are working across the NHS, the local authority, and all the teams on the vaccine programme over the last 6 weeks. So, you know, the doctors and nurses, the vaccinators are doing a fantastic job. And we've got brilliant marshals, and they have volunteered their own time. They're really cheerful. They're helping everybody have a great experience in those vaccination sites. But I particularly want to thank, in addition to Dave Julian, Nick Morrow, Joe Ferry, who are leading us for us, our practice management teams. So this is a picture of Jackie Lambert on the right and Suzanne Roberts on the left. There's also Stacey Reed. There's Sarah Mulvane, there's Philippa Bouth. I just want to express thanks to those guys. They have worked and are still working 18-hour days for the last since mid-December, and they have done a huge logistical challenge in making sure we've been able to vaccinate the vast majority of our vulnerable groups. So we really do want to express our thanks to them. And I think we need to make sure we continue to support them and help move the vaccine into a more sustainable place moving forward, making best use of all the sites we have. But I did just want to particularly express our thanks to those guys who are perhaps sometimes a bit behind the scenes, but are doing a fantastic job. So that's it for me. You can stop the sharing now. Thanks, Tom.
Thank you, Tom. Thank you, Matt. And I'm sure the governing body will want to join you in expressing collective thanks to all of those people who've put us in such a good place for the vaccine programme by their very hard work over the last few months. There's a few hands gone up there, so I'll move to Jeanette and then Paul, I think.
Thank you. Yes, I just want to add to the comments that Matt made that those centres are run like well-oiled machines, and many of us have volunteered there as marshals, and so we've witnessed it at first hand, and they really are fantastic. But what I really wanted to mention was when I volunteered there, the feedback from the frail elderly people who were the cohort that were being vaccinated at the time was overwhelming about how grateful they were, how well organised everything was, but most of all for me, how safe and how reassured they were made to feel by everybody that was involved. And I think that's really important feedback.
Thank you, Jeanette. I won't disagree with any of that. Paul?
Thanks, Matthew. Question for Matt and Tom, actually. Just on potential vaccine wastages, have you come across that? And if so, what's the strategy for any vaccine wastages that may be occurring?
Yeah, I think that's a really good question, Paul. And the answer is we are working, well, I nearly swore that, extremely hard to make sure there is zero wastage. You would not believe the efforts that we're going to make sure that not a single drop of this, well, let's be honest, it's the most precious commodity on the planet at the minute, that we're making sure there's no wastage. So we've got things like short notice lists of people we can call in if there's any extra, if we manage to get an extra dose out of a vial. If people, the very small number of people perhaps get mixed up with a day, so don't attend, we're able to call other people in. No, it works extremely efficiently. I mean, Louise might want to comment on that, but we've worked extremely hard to make sure there's as close to zero wastage as there possibly can be, and I think it's been quite remarkable actually the way the teams have achieved that. Louise?
Yeah, absolutely. Just to reassure, the programme that was rolled out on Saturday for the housebound, there wasn't one dose wasted. We had a few spare doses where we were unable to get into patients' homes that weekend, but they've been rescheduled for this weekend, and any doses that were left were brought back to the vaccination centres and used up to save opening new vials later on in the afternoon. So yeah, there's definitely a tight process in place to make sure there's no dosage wasted.
Just one further question now. Is there a equality of opportunity for all the practices if there is any reserves left, that would be given across the borough, not just to, you know, those individual practices where the hubs are.
I'll pick that up. That's right. Yeah, that's absolutely right, Paul. So we've got lists that span the whole borough. So there was some staggering of the sites at first, which is down to the speed with which they could obtain vaccine supply. But to be honest, since then it's been a very much level playing field, and we've brought everyone up to the same point. So all practices have absolutely equal opportunity, and no patient should be disadvantaged. We have had a number of queries from, in fact, a lot of queries from individual people about where they sit in the prioritisation list. But it is quite difficult for us to answer those questions specifically for individuals, other than to say you've just got to be patient with us. We're working through the groups in order. When we get vaccine, we make sure that goes straight into people's arms, and we are contacting people as quickly as we can. And just while I'm on this topic, I would just say we never ever ask for payment details. So you know, for members of the public who are watching, that we certainly don't ask for any payment details. So if you do ever get contacted by organisations that are doing so, that's absolutely not us.
Thank you, Matt. Tom, and then Tarquin.
Just a quick point, and sorry if it's quite an obvious one, but I just want to really emphasise that the staff element of the programme, the health and care workforce, is really important for us as a population as well. In South Tyneside, we've got a big public sector workforce base in South Tyneside. We employ a lot of people in the NHS and wider care workforce. So I think it's just a reminder that that's a really important strand of this programme. Is actually helping us with our overall population coverage as well, which I think is to be welcomed and good to see.
Tarquin?
I guess it's a question for the future, really. Have we got plans in place for starting the second dosage protocols? Because that's coming up quite soon, and that will coincide with having to vaccinate the much larger numbers in the groups that you've described lower down that tier system. And the second thing, I personally think we're going to be in this for the very long run, the best part of this year, and who knows if it needs booster doses at durations. So what's the long-term sustainability of this process, given that at the moment we're relying on volunteers giving huge amounts of time, particularly at the weekends, and some people working 7 days a week for prolonged periods, which isn't sustainable in the long term?
Yeah, I think that's a fair challenge, Tarquin. So you'll know that we're working on first doses at the minute, so the clear population health benefit of getting as many people to get the first dose as possible. A very small number of people got second doses who were very early on in our vaccination programme, but since the first week of January, it's all been first doses. And we'll be coming back to people from March onwards for the 11th, 12th week for the second dose programme. As you say, that coincides with the bigger cohorts in all likelihood. So I think that's where we do start to work much more closely with the mass vaccination sites. And we started having those conversations with the Newcastle, the team that are running those sites, about exactly how we make best use of all the capacity we have in the system. So it may be that vaccine supply is our biggest challenge at the minute, but workforce supply, I think you and Neil have both said, is likely to be the biggest issue moving forward. So we just need to be smart about how we make sure we're clear about where our vaccinators are and where our vaccine is. And the same point for the longer term, really, we've started up, we've got a huge programme up and running very quickly. And the next step about moving it to a more business as usual footing is a challenge, isn't it? About how we get into a regular routine using the mass vaccination sites and our local vaccination sites together. But to be honest, we've got a lot of work to do about how we make it a really sustainable model.
I'm just waiting because we've got a fire alarm going off here. I think it's a test. I hope it's a test. It usually is sometime on a Thursday. Maybe hand over to Matt whilst that's going on.
While you've got your fire alarm going off, maybe I'll just take the opportunity to say, so we've vaccinated a lot of the most vulnerable people in South Tyneside, and that's the same for the region and the country. But I think it's really important to stress that people should not be changing their behaviour on the basis of having had that first dose of the vaccine. So it's critically important that people maintain the washing their hands, wearing masks, keeping space, social distancing, not mixing with family groups. Tom talked earlier about the high level of community is coming down, but the high level of community transmission. So it probably is incumbent on us as the local NHS leader to make that point very, very clearly, that you must comply with rules and you must maintain adherence to all the guidance that's out there, whether you've had that first dose, second dose or not.
Yeah, thanks very much, Matt, for filling the time for me there. It was a test. And I would add importantly that I think that one of the principal reasons we have done very well within South Tyneside at getting the vaccine programme running so quickly is that some of the leadership that's been given to the programme by some of those around this table and others has been exceptional, in that people have been thinking ahead, people have been anticipating what's likely to be coming along the road in the next few weeks, and have been planning for what's likely to be coming in terms of national. Any other comments or questions, either from Matt or Tom, in conclusion of that item, or from other governing body members before we move on? Nope. In that case, we'll thank you both for your report, and we'll see what changes in the next 2 months, I think, going forwards between now and our next meeting. We do have the usual set of committee minutes that we take for information. No one has let me know of anything they want to raise on those. I will note for the Quality and Patient Safety Committee meeting that there's been some changes to the governance arrangements around that committee, and that we did, as a governing body, approve those changes by email, by correspondence. I don't know whether Pat or Deb wants to say anything at that point. Deb, your hand did appear, then went down again. Need to add anything there?
So thank you, Chair. Yeah, actually, you've just stole my thunder, because that's what I was just going to update the governing body on, to say that we had agreed to the terms of reference for the joint committee, and we're looking for a date at the beginning of April to get that up and running. Thanks.
We've got also there the cycle of business. We'll note that things may need to change on that cycle of business at relatively short notice sometimes, depending on things changing nationally, and so on. Kate?
Yeah, thanks, Matthew. It was just to flag that NHS have indicated that will be changes to the timeline for the audit and accounts this year, and that there will be a slight delay if we want it. I suspect, working with Mazars and our colleagues at Next, that they will choose to opt to run to their normal timetable, but it was just to flag that might slip a little bit.
Can I then just ask all directors, so that will be audit, that will be planning, there's all sorts of things that would normally be on an annual cycle that's going to be different this year, that just plead from the myself and the team that the governance team is kept aware of appraised of changes as soon as we know about them, so that we can schedule things in. That would be great. I've not been notified of any other business that needs to be raised urgently today. We do have question time from questions from members of the public, and we have been notified in advance of a number of questions that Roger Nettleship would like to be asked. So I'm going to paraphrase some of Roger's questions. Apologies, Roger, they were rather wordy, so I'm going to try to cut the nub of what's being asked rather than read them verbatim. And I think probably most of them will be for Matt Brown to answer. So the first of Roger's questions was that COVID has meant the South Tyneside cardiology ward being turned into a COVID ward, and cardiology patients being seen in Sunderland. And Roger wants confirmation from the CCG that this change is temporary. Matt?
I mean, the short answer to that question is yes, it is. So it is temporary. I mean, I think we've touched on already, we're seeing the biggest global pandemic that we've experienced in 100 years, and sadly we've seen many deaths and many people suffering really serious illness. So we've had to take really exceptional steps to manage the demand on hospital services, but we will absolutely make sure we restore those services when it's possible to do so, and we hope to do so as quickly as we can.
Thanks, Matt. The second question for Roger was about whether the effect of COVID on emergency departments would lead to any change in the plans for this summer's implementation of the nurse-led children's emergency services at South Tyneside?
No, so I think members will remember in August 2019 we started to implemented the paediatric and maternity changes from Path to Excellence Phase 1, and essentially they've worked really smoothly. There's been no adverse impact that we can see from those. So we're proceeding with the changes and moving on with the second phase about introducing the nurse-led unit. But it really clearly, it's probably worth stressing that COVID-19 is context for everything we're doing at the minute. So that is a very important factor in thinking about how that implementation takes place. So.
Thanks, Matt. And Roger's final question was about the Path to Excellence programme and linked with transport, and wondering whether Path to Excellence is still working with Nexus and transport providers to improve transport situation for people. Yeah,
we certainly are still working with Nexus, with Go North East, with Stagecoach, with all of the travel and transport teams. But I think it probably is worth saying there are limits to what we can directly influence as the NHS and even working really closely with local authority teams. And I do have to be really straight that our priority the last 9 months has been, the very dramatic pressures on the NHS from COVID, and certainly in the last 2 months, more recently, the vaccine programme. So we have been working on that, but it's not been the number one priority for us in the last 9 months or so. I think the other question for us is understanding the very dramatic changes in patient behaviour around transport since COVID was introduced. So the much more remote working, the reduction in numbers using public transport and so on. So all those things are really important for us to factor in, particularly as we move forward with Path to Excellence. And the final point I guess I'd make on that is the vast majority of travel time for patients is actually for outpatient appointments rather than when they become inpatients. So we have tried to bring those back to South Tyneside wherever we possibly can, or actually make them remote where it's possible to do. So I hope that will reduce the overall travel burden on people. But I think it would be sensible for us to bring back a more formal paper on that at some point in the months ahead, if that would be okay, Matthew. I would just say if we could have the time to get a bit further into the vaccine programme and allow hopefully some of the COVID pressures to subside, that would help us have the time to pull all that together and give it the energy that it deserves.
I'm sure people understand the operational pressures on the teams at the moment, so I'm sure we'll give you the time that's required for that. I haven't had any other specific questions asked. I'm aware that the interactivity of these meetings with members of the public is a little reduced when we're not in the same room. So please, if people do have questions, could for future meetings, emailing them in advance to the generic CCG inbox if you are watching and want any of your questions raised at the governing body is the way to do that. We can sometimes try to answer questions by email, or if there are specific governing body questions, we can try to answer questions on the day as we have done there. I think that's about it for this meeting. So I'll thank you all for your attendance, governing body members. I'll thank any members of the public who have been watching for your interest, and hopefully we'll all get back together once again virtually, I would expect, in the near future, and hopefully face to face in the not too distant future. Thanks all.